everyone, it's Professor Klein. I thought it might be a good idea to spend a few minutes kind of going over the sheep heart since we focus so much on the human heart model. We look at that sheep heart and sometimes we freak out a little bit. So what we're going to do again is just go over the structures that lab manual talks about for our sheep heart. Now here's the thing to remember, even though it looks different, it's the same structures as the human heart in the exact same places with the exact same landmarks. But again, it does look a little different. So here we're looking at the front of a sheep heart. How do I know? 2 landmarks. The same landmarks we use on human hearts. I can see a straight diagonal line from base toward apex. That is the anterior interventricular sulcus. The other thing I know I can see, and because I'm looking at the front of this heart, is this blood vessel right here. I say the one at an angle all by itself. That is the pulmonary trunk. So when you're staring at the front of a sheep heart, we've got the same 2 landmarks. We've got a base to apex straight diagonal line called the anterior interventricular sulcus, and we have a blood vessel sitting by itself. That's the pulmonary trunk. Now, since that's the pulmonary trunk, that means that this chamber right here has to be the right ventricle. And if this is the right ventricle, if we go straight up, this chamber right here has to be the right atrium. And in fact, on this chamber called the right atrium, I can even see a structure that looks like a flap called the right auricle. Messy handwriting with the mouse there. So again, all the same stuff. That means that this is the left atrium as a chamber with a left auricle as its structure, and then this down here is the left ventricle. So we've also got some blood vessels we can see here. Let's see if I can erase this. So again, my landmarks, the anterior interventricular sulcus, and this blood vessel by itself, the pulmonary trunk. When I look just behind the pulmonary trunk, granted, there's a little fat wrapped around them, but there's 2 blood vessels I can see here. One is here, and it happens to be attached to this other one pointing there. If I were to chop all that fat away, that's kind of what I would see back here. This first blood vessel, if I put a pointer in it, it would be pointing toward the ceiling. That is the brachiocephalic artery. This blood vessel kind of next to it on the diagonal, well, that's the aortic arch. So you might want to take a few seconds, I'm going to erase, you might want to take a few seconds, find those 2 landmarks, again, the anterior interventricular sulcus and the pulmonary trunk. Practice identifying this chamber and its structure, 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 this blood vessel, and this blood vessel. So now we can rotate this heart around and we can look at a couple of landmarks that are back here and then the structures that are on our list. This is the posterior surface. How do I know? Well, I don't see that straight line that's obvious base to apex, and I don't see a blood vessel on the diagonal by itself. So what do I see? I can see a sulcus that comes down and turns. It's not a straight line, it turns right at the apex. That is the posterior interventricular sulcus. So if you're staring at the posterior interventricular sulcus, well, this becomes the right ventricle. So that means this is the right atrium. This mushy stuff up here, that's going to be the left atrium. And if we travel down from that, we have a left ventricle. So that's our orientation when you're staring at the back of the heart. Now, when it comes to the veins associated with the two atria, they can be a little tricky to see. They're gonna kind of sort of just look like mushy holes, almost like plastic grocery bags from the grocery store, whereas arteries are nice and big and thick-walled. So let's erase this and do our best to look at some of the vessels that are back here. So on this right atrium here, hard to tell on this picture, but there's a hole right here that's attached to it. If we were in the lab, I'd stick my finger in that hole, my gloved finger, and I'd push it through, and I'd pop out a hole down here. This hole at the top would be the superior vena cava, and then the hole down here that I would have popped my finger out of, that would be the inferior vena cava. Now, if we go to the other chamber, we can see, again, it's kind of hard to see there, but there's a couple of holes here and there's a couple of holes here. Well, those, again, if we stuck our fingers through them, we'd find our fingers going in the left atrium. And so those are the pulmonary veins. So again, I'm going to erase, find your landmarks, spend a couple of minutes on this slide reviewing those structures. Okay, imagine we've now performed one of the incisions for our dissection and we have sliced through the right ventricle. The slice you see here, that's the wall of the right ventricle. So we cut through it and we opened it up like a door and we're staring straight inside of it. Now again, how do I know this is the right ventricle? Well, I have two landmarks. First, look at the thickness of the right ventricular myocardium. And recall from our conversations that the right ventricular myocardium is not very thick. It's thicker than an atrium, but it's not nearly as thick as the left ventricle. So that's how I know this is the right ventricle, the thickness of the myocardium. It's, you know, a little bit thick, but not like the left side. Now, since the other thing I know that I'm staring at the right ventricle is this band right here. It looks like a band of muscle that goes all the way across. That's the moderator band. The moderator band is part of the electrical conduction system of the heart. So we are bringing action potentials by way of axons kind of across the ventricle to the papillary muscles on the other side. So again, how do I know I'm staring at the right ventricle? Couple of things. The thickness of the wall is your best landmark. And right ventricles will show a moderator band. Now in the right ventricle, I can see a couple of things. I can see this flap. There's a flap here. There's a piece of the flap over here. It looks like I cut a piece of the flap here. There's a flap. Attached to the flap are these strings. Okay? And then those strings, in turn, are attached to a finger-like muscle in the wall on that ventricle. Little trickier to see on the other flaps, but they're still there. So I have a flap, some strings, and the strings are attached to a finger-like or finger-shaped muscle. Now in the right ventricle, this flap is the tricuspid valve. Those strings are the chordae tendineae, and they are attached to the papillary muscles. Now we've talked a lot in class about functionality of these things, right? The valve itself closes the orifice to prevent backflow of blood from the right ventricle backwards into the atrium. The chordae tendineae and papillary muscles work together to prevent prolapse of that valve during systole. So far we've seen that we're in the right ventricle by the thickness of the myocardium. We can see a moderator band, the tricuspid valve, its chordae tendineae, and its papillary muscles. Now if you look on the wall over here, you see a bunch of wrinkles that come about because of the texture of the cardiac muscle bundles and the orientation of the muscles. Those are the trabecular carni. So you can kind of think about it this way. If it's a wrinkle by itself, trabecular carni. If it looks like a wrinkle, but it's got a string attached to it, that's a papillary muscle. Now we can kind of sort of see that there's a little bit of atrium up here with pectinate muscles. And the last thing we can kind of sort of see is if you follow this chamber, this ventricle, we could see that the blood would go up here and out a blood vessel. So this blood vessel I'm going to bracket, that's the pulmonary trunk. And so these little flaps of tissue I'm coloring on, it's here, it's on that back wall, it would be on the side wall but we'll cut through it. That would be the pulmonary semilunar valve. So again, I'm going to erase. I want you to use your landmarks and pause the video and practice identifying all of these structures on this picture. And it's a good time to remind yourself about functionality as well. So here we have a close-up of a pulmonary semilunar valve. So we see that the person is doing the dissection. We see their gloved hands. Here's the edge of the pulmonary trunk. Okay. And the pulmonary trunk is coming down, and we see it's converging off of, or branching off of, the right ventricle here. You can even see some chordae. So right at that junction between the pulmonary trunk and the right ventricle, we can see cusps. By that I mean thin folds of tissue, and they're cup-shaped. So here's a cup, and the other cup would have been on this front wall that we've sliced through. Those are the pulmonary semilunar valves. Recall their function is to prevent backflow of blood from the pulmonary trunk to the right ventricle. So you've heard me say a lot in lab and lecture, right? Blood needs to always move forward. Blood needs to go vein, atria, ventricle, out. So when the blood is in this ventricle, when that ventricle ejects at the end of systole, we want the blood to go out and then not be able to slip back in. So again, maybe take a moment to review the structure and functionality of the pulmonary semilunar valves. So now we can see both ventricles. I'm going to outline them for you. Okay. There is a ventricle here, and then there's a chamber of ventricle over here, and we see this thick wall between the two. And if you look carefully, you'll even see atria above them. So again, how do we know which ventricles we're staring at? Recall, the trick is always inside of a heart, be it a real heart or a model, the trick is always the thickness of the myocardium. So here's some myocardium for you over on this side, but here's myocardium on this side. And you can see that this side I'm coloring on right now, the myocardium is way more thick. So that means that this is the left ventricle. And if we go above it, we would see that this is the left atrium. So if that's the left ventricle, that means on the far side with that kind of thinner myocardium, that's the right ventricle. This wall between the two, that is the interventricular septum. So now that we know we are on this side staring at a left ventricle, I'm going to go ahead and erase my marks, and we're going to see what's in there. So we can see two flaps. So these are the flaps. These two flaps have strings attached to them, and those strings come down and they touch finger-like muscles. You can see them here and here. We can see a big one right here. Okay, so again, we've got solid flaps, strings, and fingers attached to the strings, and in this case, a huge one. So those fingers attached to the strings, those are still papillary muscles. So that's a papillary muscle there. They're still preventing prolapse of the valve. These strings are still chordiotendining. They're still helping to prevent prolapse of the valve. This valve, however, these flaps are the bicuspid valve. So these flaps right there, bicuspid valve, also called mitral or mitral. Now, bicuspid tells you it has two flaps to it. Mitral is for miter, it's the shape of the flaps. But again, how do I know I'm staring at the left ventricle? The thickness of the myocardium. Otherwise, I can still see chordae tendineae, I can still see papillary muscles, I can see the septum between the two ventricles. I can still see wrinkles, especially on this side, that are trabecular cardi. I can see the wrinkles inside this left atrium. Those are the pectinate muscles. Okay. I can see the flap that is a bicuspid valve. The last thing I can see here, although not the best picture of it on this heart, is if we followed the blood out, we would see it would have to go back these little flaps into the aorta. So these flaps here would be the aortic semilunar valve. So again, I'm going to erase. I encourage you and highly recommend pause, review, and practice identifying those structures and explaining their function.